Welcome to Docs on Call, brought to you by Methodist Medical Center, with your host, Gina Morse.
Good evening. This is Docs on Call. The American Pain Foundation estimates that more than 50 million Americans suffer from persistent pain each year, and 1 in 3 lose more than 20 hours of sleep each month due to pain. Chronic pain not only causes physical discomfort, but also interferes with social relationships, family life, and self-esteem. 2 physicians from the Methodist Comprehensive Spine and Pain Center will answer your calls tonight on the topic of back, neck, and other types of pain. Boyan Pavlovic is a doctor, an interventional pain management specialist who's board certified in anesthesiology. Daniel Mulconray is a doctor who specializes in adult and pediatric surgery of the spine and performed the area's first cervical disc replacement surgery. If you have questions for them about pain, call 698-3742. It appears today's baby boomers may have more aches, pains, and disabilities than previous generations. Using data from the 1990s, UCLA researchers looked at how well people over age 60 were able to perform daily activities like walking, preparing meals, and getting dressed. By the time they turned 70, many had developed disabilities, but those who were already over age 70 and even 80 did not develop as many physical problems. Researchers say those who were in their 60s at the time may have spent more of their lives being overweight than those who were older. We've got a lot to talk about today, gentlemen, and we thank you for being our guest this evening. And in fact, we already have a caller on the line. Shirley has a question for us. Shirley, you are live on the air with Docs on Call.
Hello?
Hi, Shirley. What's your question? Shirley, can you hear us?
No. No. Oh, I can now. Thank you.
Okay. Go ahead with your question.
My husband has chronic pain left from a bad attack of shingles from chemotherapy 4 years ago. And we have been to pain clinics before, but I've been looking into the new treatments of cryonic freeze or radio frequency. I have heard about those, and I just don't know which one might work for him the best.
Doctors, what do you think? What might you suggest initially after hearing Shirley's question?
I think what's important is to take a comprehensive look at what's going on. Where's the location of his shingles?
Shirley may not still be with us on the question. What you asked that question? Why would it matter where the shingles were located?
There's different approaches to treating shingles. In particular, some people will get it along their chest wall, some along their face. Different nerve distributions imply different areas that are targets. Areas that go along a certain branch of a nerve along the chest wall or the face can be amenable to many treatments. There's nerve blocks you can perform. There's epidural catheters that can be placed. Spinal cord stimulation is very promising for this. There's many medications that can be tried. There's quite a few things that can be attempted for this. Some things can be very promising. So it's important to be given all the options.
Managing pain is not as simple as just popping an aspirin. I know that you guys really want to encourage people to look at what's going on with their bodies or their loved one's pain more seriously and really consider the implications of maybe over-medicating or under-medicating and talk to their doctors. I mean, and Dr. Mulconry, you specialize in adult and pediatric surgery. What are you seeing in terms of pain management, the differences between adults and kids?
Most of the time, luckily for children's sake, we see much more chronic pain in the adult population. Very few of the young adults develop chronic pain syndrome. Most of the time, it's very difficult to discern if there's some underlying pathology that could be the origin of the child's pain versus, better speaking, kind of your run-of-the-mill teenage back pain. Fortunately, the vast majority of teenagers with back pain do not have any true underlying pathology, but rather some type of musculoskeletal strain, oftentimes very responsive to physical therapy or a manipulation intervention. And therefore, most of the adolescents I see improve much more with therapeutic interventions, whereas in adults we're dealing with a much more chronic, much more degenerative process, especially as you mentioned previously with the baby boomers. We're seeing this more and more frequently in the population. And actually, so in the adult population we see a lot more chronic pain patients. I think one of the main things that Dr. Pavlovich and I both agree upon is that rehabilitation and trying to get these patients back to their previous lifestyles and helping them deal with the pain, not only physically, but emotionally and mentally as well.
Well, and you bring up the emotions. This is sometimes a very tricky kind of ailment to deal with. Dealing with a person's psyche as well, and maybe even sometimes trying to convince them that they can deal with this in ways that they did not imagine, be it physical therapy or some other methods. We have a lot to talk about. We're going to take a quick break, and we're going to be right back with your questions on Docs on Call.
Before I retired, I made sure everything was in place, so my wife and I never had to worry. The same is true when I make decisions about healthcare. It's important to get the facts. I went to ChooseMethodist.com. I saw for myself how Methodist measures up and heard real patients telling their stories about the higher level of care at Methodist. Quality, value, service. Fact is, Methodist ranks the highest in the area. And when it comes to protecting those you love, that's what means the most.
Welcome back. This is Docs on Call, your chance to ask questions of our experts about pain management and treatment. The number to call is 698-3742. We were mentioning during that brief break, you were mentioning to me that you actually have a pain psychologist on staff to deal with some of these issues. How does that person help?
It's quite an advantage at the Comprehensive Pain and Spine Center. We have multi-medical and multidisciplinary approach to chronic pain in general. We have monthly case reviews, patient discussions in which we have our pain psychologist present as well. Oftentimes for patients with chronic pain, we will send a referral over to her, and so we deal with the problem not only physically but also emotionally and mentally as well.
Well, and because we know too, especially nowadays, with the kind of economy we have and job loss, stress often leads to physical pain. And if you learn how to manage that stress, maybe some of that pain goes away too. And maybe sometimes it's not that simple, but
Absolutely.
A good point that you have that psychologist on staff to help. We've got a question from Anne who called in with this, and I'll see if I can read the handwriting here. Let's see. And maybe you can read some of the language here too. Has DDD and has.
So Anne tells us she's had previous cortisone injections as well as physical therapy, and she asks us what.
See, I'm not the only one who cannot read the doctor's handwriting in messages.
I think it possibly what accounts for back pain and radiation. The patient has degenerative disc disease and has had these cortisone injections, which most of the time refers to epidural steroid injection. And is there anything new or anything new that can be offered?
And what would you say to Anne?
I think thinking of pain management in terms of just epidural steroid injections is kind of an outdated way of looking at pain management. These days we do much more than that. Like we were mentioning, the psychological perspective, I do make my patients aware at their initial visit just the strong tie that emotions have with pain. And so when they're more aware of stress and things like that that can be exacerbators of pain, it's necessary to do that. As far as the psychological side of it, on the physical side, the interventional offers many things. We try to break down pain into its different components, whether it's back pain primarily or pain that radiates into the lower extremities. And then we can target different things. We can target the discs, we can target the nerves, and we can target the joints. And through targeting these various structures, we can achieve some very good results in conjunction with medical management, which I think is very often necessary.
And that's not always surgery that you're targeting these pains with. It can be a variety of methods.
I think we try and incorporate everything, and I try to make my patients, we both do, try to make our patients